years ago, Chance and I decided to set a goal to try to decrease the babies that we were transferring to the city due to respiratory distress. We wanted to be able to keep our babies here with mom.
So with that in mind, we took our goal up to our administrative team, to our CEO and our chief nursing officer, as well as Dr. Greg Staker, the chief of the physicians, and presented them with the goal that we wanted to be able to keep more babies here. And they were very supportive and very kind and challenged us to go find a way that we could do that. And the end of that search was we ended up partnering with Intermountain Healthcare through their telecritical care or telenewborn critical care program. And with that, we've been able to have access to 14 board certified neonatologists who can just pop on and be in the room at the click of a button. And we were also able to work very closely with two physicians specifically, Dr. Stephen Minton and Dr. Sean Odell, who actually have come to the facility multiple times and helped us hands-on develop the early lung recruitment program.
As Chance mentioned, the early lung recruitment program, which we call in short is ELR. So the early lung recruitment program is an advanced NRP, which is a neonatal resuscitation. It is basically CPR for babies. And to be nationally certified as a neonatal resuscitation, we have to do training every 2 years. It's a strict training and testing to pass it, but it's only every 2 years. And with Dr. Odell and Dr. Mitten, they felt like the nurses and respiratory staff, all hospital personnel, needed to do the training more often. So that's where they came up with the early lung recruitment, taking it so that training is every month. And we do 2 hours of intensive training and testing where the nurses will have scenarios where we go through and of maybe a situation that may arise when they have a delivery. It helps them to be prepared for what situations can arise.
So we've actually been doing early lung recruitment since late in 2016, and it's been wonderful to watch our goal be fulfilled with this program. It's benefited the community so much because instead of respiratory distress being a major reason we were transferring babies, now 99.5% of all babies that are born with respiratory distress that receive ELR in our facility get to stay here and stay with mom.
Katie Holmes. This is Axton Holmes. My pregnancy was super normal. Like, it couldn't have been more perfect. Textbook, wasn't hardly sick. I just went about my day and I went to work and everything was perfect. So it was a Sunday and I was just chilling at home, just a day off, and it was about 9 o'clock at night, my water broke. When they got him out, Axton wasn't breathing. He was really blue and gray and not normal colored. So the respiratory team was there and they were helping with him and he just wasn't breathing, and so they had Dr. Staker come and he eventually got him breathing, and then his heart stopped. So Dr. Staker did CPR and he got his heart back and got him back with us. And sorry, I'm trying to clear up. He got him back and they got him all hooked up to all the stuff. So it basically saved Axton's life. If you guys didn't have that program, then I'm sure he wouldn't be with us today and as healthy as he is and wild as he is. So it's just an amazing program that you guys developed. When they were working together, Dr. Staker and Dr. Mitten, they worked together for 45 minutes, and my husband, I'm sure, could see, and then they introduced him, and so my husband, it helps a ton, like comforting, knowing a face, putting a name to a face, seeing how concerned he was with Axton and how important he was at that time. And like when my husband got out there, he just knew exactly what to expect, and everybody was on the same page. There wasn't any confusion. So we had Dr. Christina Mogos. She was amazing. She would check on him, and even when she was supposed to be going off of her shift, she would come and like say bye to him and just talk to him for a bit. She was, I don't know, even she was put into a different room towards the end when we were getting ready to go home, and she would still come and say hi to him She was just an amazing doctor, and like always very caring. And thank you, like from the bottom of my heart. Sorry, for giving me Axton, making sure he came to me and I got to be a mom. So just thank you, and give him big hugs for everybody. That's what I would love to say.